Hi, my name is Kris from Muskingum Behavioral Health. Today we're here to talk about how to talk to your kids about drugs, which is not always an easy task. The most important thing is don't be an ostrich. You want to believe that your kids would never try anything, that they have the best self-esteem, that they're safe in their environment, they go to a good school, they go to a good community. But the truth is, drugs and alcohol are in every community. So we need to be ready. We need to be prepared to help our kids. We want to talk openly without being preachy to our kids. We want to convey a sense of trust. They will make the right decisions when they're not with us. And it's never too early to start. Even with little kids, when you're giving them medicine, talk to them about how only sick people should take medicines, to only take the certain amount that the bottle says, to only take medicines from a trusted adult, and never say, medicine is a treat or candy. Another thing you can do is just talk about them being healthy. Like a bedtime, talk about how you're choosing their bedtime so their body can be healthy. Talk about ways that when you're brushing their teeth that we're keeping our teeth clean, and that's part of keeping our body healthy. Read to your child about making good decisions. With such books like Smoky Dragon, talks about a dragon who is learning to make good decisions for his body. Rabbit's Habits. It gives your child a practice on how to make good decisions. And Sly's Unwise Surprise. These are all age-appropriate books that can convey a good message for the future. The local library will have many more as well. But talking to older kids and teenagers may be a little bit more challenging for parents when it comes to talking about drugs, but it's okay. We have some tips. And as a mother of a 16-year-old, I know it can be difficult. But the first thing you need to do is educate yourself. Know the facts. You can call Muskingum Behavioral Health or the Mental Health Recovery Services Board to get these facts. We have many people that can talk to you. We have brochures. And we have many resources that parents can use. Find a comfortable setting and avoid saying things like, we're going to have a serious talk after dinner, because oftentimes that brings up a little bit of nerves with you and the children, and then they might be closed off a little bit. What I like to do is find an open space where it's less formal. It's getting to be fall time. Maybe if you're out raking leaves, that would be a great time to talk. Taking a walk. Sometimes even it's a closer space, but I find that is where we have the best conversations in my family is in the car. You want to ask open-ended questions too, because if you give a teenager or older child an opportunity to do yes/no questions, they're going to do just yes or no. So ask open-ended questions like, what do you know about drugs? Or how do you feel about smoking? After the conversation, thank your child for having a conversation with you, because just as much as you feel uncomfortable, they probably do too. And let them know that you appreciate their time. That goes a long ways. Be curious and show interest in the little things in their life. Not just about the big things, but the little things. Maybe something that you see that they're collecting, or an activity that they're in, or a book that they may be reading, even if it's a book that they have to read in school. Just be curious at all times. Avoid cutting off your child with their response. Sometimes you need to wait 2 to 3 beats before interrupting, because sometimes if you just let it go a minute, they might add in more information because you're not showing the shock factor. Be aware of your body language. Is your arms closed? Is your feet crossed? That may give a message of you're closed off and mistrusting. So kind of set casual and be comfortable. If your child is sitting down on the couch, you should sit down on the couch. If your child is leaning against a wall, you should lean against the wall. Modeling their behavior is a sign of respect. And most of all, be calm. If they tell you something that may shock you or make you angry, try not to be overdramatic. Because once we do this, that is a sign of they're not going to tell you anymore. Because whether you know it or not, they don't want you to be upset. Try to stay calm and talk about it. Practice active listening. Make sure you have eye contact with your child. Repeat phrases that they may have told you, and be non-judgmental. They're growing up in a totally different world than we have. You know, parenting today is challenging. There's a lot of new things going on, but we don't have to do it alone. Talk to other parents in your community. Talk to your friends. Talk to your kids' friends' parents. And you can call the Mental Health Recovery Service Board or Muskingum Behavioral Health. They can guide you through this and give you the facts. The one thing we know about our community is we care.